I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, premenstrual disorder, and infertility.
Today we're going to be doing our very first Reacts video. We'll see how it goes. I'm actually really excited about it. There is a sort of viral video on TikTok that I just showed you today. And we're going to do a Reacts video and just give you the actual evidence-based information about the video. And I want to make sure that we point out that this is like not shame to the creator, and we're not like mad or upset or frustrated. We're like not calling her out and like specifically, but these are the things that we deal with all
This
of
is
the
what we've been
time.
educated on. This is what we have our career in. And so we just want to make sure we're putting out the evidence-based information so that people have all the information.
Right. Before we do the video, can we please just define evidence-based? We've had all these videos. We've never defined evidence-based before. I think it's really important that we might do that.
That's a good point. Yeah. So evidence-based medicine or evidence-based anything means that we've looked at research that has been done in most cases over decades, because research takes a long time. Studies take a long time to organize and get funded and find participants and analyze data and get published and all that stuff. So it's usually things that have been decades of research and information, and it's not just one study, right? Like that's why it's important, even though the news sometimes will highlight.
Oh no, sorry. Okay, we're good there. Sorry.
Sometimes the news will like highlight one study showed this. We don't really take into account that one study. Like we want to look at what is research showing across the board and what's the general consensus of different research studies.
Yeah, sure. One research study can be like really important, but it's usually like because they have smaller research to support that they like had that idea or whatever. So evidence-based is really a totality of the information. So there might be a little bit of evidence you can find and search to support some of these ideas, which is fine. And I think those are important things to have, that we continue to do research so that we have a consensus about what's going on.
Yeah, and things that hold more weight in evidence-based medicine or in research are studies that are done in specific ways and have lots of people involved. So hearing just one person's story isn't considered like an evidence-based way to do something.
Sure. Yeah. You ready?
I'm ready. Let's do it.
So the craziest thing that I didn't know about and nobody talks about is how you have literally 0 hormones after you give birth.
Do you have 0 hormones after you give birth?
No.
No. We've talked in other videos about this, right?
Yeah.
It's about the change in hormones that can create issues or problems, but you go from the highest level of hormones that you've ever had in your entire life, no matter who you are, for most people, to regular amounts of hormones.
Or going back to like pre-pubertal levels, but you still have, they're still there. It's not 0.
Right.
But estrogen and progesterone are very low. Testosterone is definitely not 0.
Right. No. So that's sort of misinformation, or just like a exaggeration of the reality.
Yeah.
Right. Okay.
So after you have a baby, all of your hormones are depleted and you feel terrible.
Okay. So are your hormones depleted?
No.
No.
Your estrogen and progesterone when you're pregnant are mostly made by the placenta, and when you deliver your baby, you deliver the placenta. So estrogen and progesterone levels get really low, but that's like normal. That's supposed to happen in a woman's body. That's what's been happening since we were created or evolved or whatever. That happens. It's just normal.
That's what happens.
It's natural.
That's just how it is. That's what my parents say. That's just how it is.
That's just how it is.
And yeah, the majority of people feel terrible from that.
I don't know if I would agree with that.
Well, I mean, we have baby blues.
Yeah, I think the majority of people feel off. Like they feel more emotional.
Okay, maybe terrible is not the most appropriate use of word there, but just like people feel different when they have changes in hormones.
Yeah. That's
So yeah,
normal too.
you're gonna feel
Natural.
different.
Yeah.
That's okay.
That's okay.
Yeah. Okay.
And fatigue, I literally couldn't think. I couldn't get out of bed. I felt terrible. So I went to my regular doctor, and she was just going to give me like Zoloft or something that I could take while breastfeeding.
Okay. Her doctor was gonna give her Zoloft.
We just want to point out that good job.
Well, also, I think it's great to like go and talk to your clinician about
Yeah.
what's happening. That's great.
Yeah.
Go talk to your clinician.
Yes.
And I think that it's likely that that person was using evidence-based medicine.
Yeah. So if we are using evidence-based medicine, the treatment with the most evidence in terms of being the most efficacious and being the safest
Mhm.
that we have today so far, while this video is being made,
Which
are
could change.
SSRIs,
Right.
which
And
Zoloft is an SSRI.
right. And I mean, Zoloft is used and it has been used for a really long time, so we have a lot of evidence about it.
Yeah, Zoloft has been used for decades upon decades for anxiety and depression, and specifically for postpartum anxiety and depression, it's been used for decades as well.
Right, and it's excreted in very small amounts of the breast milk, so that's another reason that someone might like it as an evidence-based choice for treating postpartum anxiety. Right,
Depression, yeah.
and depression. Yeah. Okay, so
I also asked her if she can test my hormones, and she said, no, you're young, you're healthy, we don't need to do that. So I was like,
okay,
So
we have a whole video on this. We have a whole video.
We do have a whole video on this. So go back and watch that video.
I'll link it. Yeah.
But testing hormones postpartum is not evidence-based. You're just wasting your money, really.
Probably. Yeah.
I mean, people make a lot of money off testing other people's hormones. I'm just going to put that out there.
Yeah.
But yeah, it's not evidence.
So, okay, when we think about things in medicine, if we're going to do an intervention or if we're going to take a test or like do something, we need to know how we're going to change the way we approach the problem with the answer.
Yeah, with the information that we get from that
Yeah.
test, how is that going to change what we're doing for the patient?
And if you have hormone levels that are off or bad or wrong or whatever, what are you going to do with that information? And if you're selling hormones and not practicing evidence-based medicine, you're just going to make money off of that.
You're going to give them hormones because then you make money off of giving them hormones.
Right. But that's not the most evidence-based way of approaching the problem, because if we're giving someone estrogen or progesterone in the postpartum period, like that's not risk-free.
Yeah, and we don't have any research saying here are normal levels of estrogen, progesterone, and testosterone in the postpartum period.
Mm-hmm.
So we don't have like a bar, a standard set for us on like what even is normal in the postpartum period. It's probably like a wide range. And number two, that doesn't help diagnose anything, so or treat anything. So because your hormones are off or not in that normal range, that is not a cause of postpartum depression or postpartum anxiety.
Mm-hmm.
In patients where we see postpartum depression and postpartum anxiety, it's usually correlated more with like they're not correlated, or it is correlated.
I mean, it's complex, right? Because as we have said in other videos, it's about the change. It's not about the level. So like we don't know unless you're testing them like daily or like really frequently and you're in some kind of study to know like, oh, you're at this level and now you're at this level and that means this thing. Like we don't have that data to support using that information or even having that information to change how we're going to move forward.
Right. Yeah. And there, I'm kind of backtracking on what I'm saying because we do have research looking at, and again, it's only like 2 studies, I think, looking at what do testosterone hormone levels
wait, I think it's later. That's later in the video.
Oh, okay.
Yeah, she's going to talk about her testosterone.
Okay, so cut that out.
We can cut that out, yeah.
Okay, whatever. Luckily, I had a friend who just went to hormone specialist and got her hormones tested and got hormones put into her, and she was telling me how amazing she was feeling. She's like, you need to go to a hormone specialist. So I went to one in Nashville. It's called Full Life, and I got my hormones tested, and my testosterone was at 19. As a woman, it's supposed to be at, I think, like 150 250 to 300. That's the normal level. Mine was at 19.
We don't know. We don't know. I mean, I think that's just made up.
I don't know where they got that information.
Yeah, I don't know either. I mean, the reality is that, like, the same thing we've been saying, like, if you have a hormone level, like, that doesn't necessarily mean that you're going to have depression or anxiety or whatever, right? And we have data to support that it's actually, in some cases, increased testosterone that might be contributing to postpartum depression.
Yeah, so there's 2 different research studies looking at testosterone levels in women postpartum and showing that the higher the testosterone level, actually, the greater the correlation is that that person has postpartum depression. Or anger was another study looked at anger postpartum, which we see a lot in postpartum anxiety. So low testosterone postpartum, if we're going by evidence, actually would be less likely to have postpartum depression or postpartum anxiety.
Yeah. Okay. So levels, again, not
just don't test them.
Yeah.
And when you have no testosterone in your body, the symptoms are anxiety, depression, tiredness, brain fog, all of the things I was experiencing. So this hormone specialist told me that that was normal and he was going to give me some testosterone, which he did. And he says it takes about 10 days to kick in. It's been a little bit over a week, and just in the last day, my energy,
I just no.
I'm glad that she's feeling better.
Yes.
I'm glad that this treatment worked for her. And I think it's important to point out that testosterone is not.
It's not. There was a study in 2001 in Austria, and I think the direct quote from the study is there's no correlation between testosterone and energy levels and vigor or something in the postpartum period. Yeah. That's a direct quote. Not exactly, but it's kind of close.
Yeah.
So, I mean, that's just not how it is. That's not what the evidence shows. And that might be true for her. And it would be really nice if we had the evidence to support, these are the subset of people that testosterone is the most evidence-based treatment for.
Yeah. Oh, yeah. I mean, hormone industry, they make a ton of money. So I guarantee you, if there was evidence and research showing that giving testosterone or progesterone postpartum was a treatment and cure for postpartum depression and anxiety, people would be all over that.
They're already all over it without the evidence, though.
Well, yeah, but I'm talking about
physicians,
doctors, evidence. People who are practicing evidence-based medicine would also be all over that because you can make a ton of money off of it.
Yeah, yeah. So I really am glad that she's feeling better, but that's just not evidence-based way of approaching the problem.
Yeah.
Yeah, and because it's viral, that means that other people are going to do it too, and that might not be the least risky solution for them.
Yeah, hormones have risks.
Yeah.
I actually have energy. My energy is finally starting to come back, and I can think clearly. I'm feeling way better, but the annoying thing is why don't people talk about your hormones after you have a baby? Because I felt so terrible.
We do that.
Yeah, people do.
Well, the reason that's not a thing is because oh God, that's just a whole other thing we could talk about in a whole other video. It's you have 1 million visits when you're pregnant, and you get one postpartum checkup. There's women are just forgotten after they deliver babies. So why is that not happening? That's a societal issue.
Yeah, American issue.
Okay, moving on. We're doing a whole video about that.
And the doctors just throw medicine at you, which is a band-aid, but the true problem is your hormones. So if you're
medicine is not a band-aid.
That is not true. That is 100% not true. And yeah, okay, and let's just step back. Testosterone is also medicine. Medicine, if you're going to put a label on it, it's something that's manufactured and sold
for the intent of treating an illness or disease or problem.
Right. Medicine can be a supplement. Medicine could be a synthetic thing.
I mean, okay, I did take a class in college on the definition. It was part of the class, and it is the intent behind it, right? So if you're like using cranberry juice for a UTI, which is, I don't think, evidence-based, but you could call it medicine because you're using it with the intent of treating something.
Yeah. But anyways, we digress. The point is, she says medicines are just a Band-Aid, and we have a whole video explaining why antidepressants, which I think she means antidepressants are just a Band-Aid. We have a whole video on why antidepressants are not actually just a Band-Aid and how they work on a biochemical level to change what's going on in your brain, which theoretically hormones also do. Like changes in hormones also change biochemical things going on in your brain.
Exactly. Now,
you're postpartum and you don't feel right, go get your hormones tested. There's tons of hormone places in cities. I went to one in Nashville. It was amazing. My doctor was amazing, and it has totally helped me. So if it can help somebody else, like, definitely do it.
hey, again, glad she's feeling better, but don't definitely do it. Definitely,
Yeah.
don't do it.
I would talk to your doctor about it, and I would also maybe look at all the options and ask for the information, right? Make yourself an educated guess or an educated decision on what you're going to do.
Yeah. Okay. Hope this was helpful as our first Reacts video.
Yay!
Yay! Okay. Hope you enjoyed this. Please like, comment, subscribe. We'll see you soon.